Hey, good evening, everybody. We're having some problems here taping this. I am going to wait till someone joins in here. Um, and we did just get, looks like Denise and Faye both came in. So hopefully this is working now, and we'll find out. If not, I'll just pre-record this for later to post. So great. You can hear me now. Okay, good. I think what I was doing was I had a fan in the background and it was interfering with my recording. So good. All right. So let's try to do this again. Hi, Amy. Good evening. I really like these live recordings. I'm getting used to them. I'm getting more comfortable doing them. Hi, Carol. Um, so before I begin again, um, if my patients or clients are watching this, I have this posted in various places. I'll do repost. If they go on my website, they'll be able to be connected to Facebook and or be connected to where the videos are. So clients and patients, if you're hearing me call out people's names, it's because I'm doing this live right now on Facebook. And unless you're part of the Facebook um, friends or family or what have you, you won't be able to hear me, of course, interacting except on here. So if you hear me calling out names, it's not that I'm going delirious or hallucinating or anything like that. It's just because I'm answering people's questions as I go. So it looks like we have a reunion going on right now on the side here. Um, the reason, hey Brad, um, the reason for my taping this evening is because I'm getting a lot of questions, a lot of phone calls, and right now everything's getting really chaotic and stressed, trying to get ready for Monday. So I thought I'd try to answer everyone's questions about the wound and the illness and everything that you have right now. So hopefully it'll clarify things. And then, of course, I'll be more than glad to talk to everybody after this is over. It's just I'm getting such a volume right now of calls coming in. I don't, I don't have time to take every call. So, with that said, I do apologize. I was going to do this earlier, but after the move, I really conked out because I overdid it, and of course, and the pain was hurting real bad, so I had to sleep it through. So here I am. I got my coffee and I'm ready to go. So the main question is this wound diabetic? Um, and there's a few answers to that. First of all, this wound started out back 2 years ago. I was told I was diabetic because my numbers kept fluctuating, blood pressure and my sugar levels were fluctuating really bad. And so they said I was pre-diabetic and then diabetic and then you're insulin dependent. At the time, I wasn't overweight like I am now and everything. And I was watching what I was eating and I didn't understand it. But I did what they said. Got tons of pills they were putting me on. Um, and it was last October, I ended up getting my foot was really dry at the bottom. Um, and so I just got a shower and I was drying up my foot and I had pulled a piece of skin off and that skin was basically it made a little cut at the bottom of my foot, but I didn't think nothing of it. And about 2 weeks later, um, I started getting really sick. Started having hallucinations. I couldn't walk that well because I was so lightheaded and dizzy, and it was just bad. And of course, instead of going to the hospital or the doctor, I kept working through it and trying to not go to the doctor. So, because I'm bullheaded. So I ended up having sepsis and my organs were shutting down. Good evening, Jody. And so in the hospital, they're giving me a lot of fluids, antibiotics, etc. And they took a look at the foot and said that the infection was coming from the foot. So they did an MRI um, and said that they had found a abscess at the bottom of my foot. Now you have to understand, for years I've had a foot problem. Always had pain in it, and I would, they're saying because of neuropathy that I made it worse. but I was trying to explain to the doctor, you understand, when I was a teenager, my foot would hurt, and I would just plug right through it. I wouldn't stop unless it was, really aching at the end of the night. But my college years, I would just bang right through it. If a bone shifted, I could feel it. It would be painful, but I just walk differently, and I'd go right through the pain. So it wasn't that I had neuropathy or couldn't feel the bottom of my foot. I felt it, and I knew what was going on. For the most part, I knew I had a bad foot, but they were saying that due to the diabetic neuropathy, that's the reason the condition of my foot became so fragile and started fragmenting, and the bone is all splintered at the bottom. It looks like cotton balls on the X-ray, and a lot of fractures in the middle of the foot. It looks like someone took a hatchet and cut it in half and broke the foot in half. Um, I'm kind of let's just put it this way. I think that there's more than one reason a person is diabetic. I think that it's not always what we eat. I think it's pre-symptomatic to other things, or other complications or conditions that we have that can very well be. And I think that's what happened in my case because I've always had this condition. I think the pain tolerance that I have is very high. And the more pain I had, the more infection I had, my numbers went up higher, both blood pressure and sugar levels. And the doctor that I last saw actually agreed with me, for once. Um, so I don't believe that it's always diabetes that is due to your lifestyle and the way you eat, because we got people out there that's athletes that are having diabetic problems. I think this was pre-symptomatic to other things. Irregardless, the wound was there. The doctor said that he was going to drain the abscess at bedside since I couldn't feel anything. He stuck a scalpel in there. Only serous fluid came out, so it was just clear fluids. There was no abscess. Since he cut into there, the wound opened up. I always had a problem down there where a ball would be formed if I was on my foot too much. When you put pressure on it, it would hurt really bad. And so I'd readjust the gait to it. So that I'd be able to walk better. Um, and that's where he cut into. And I had made a comment that I feel that looking at the X-ray, I had bones that were splintered pointing downward at the bottom of my foot. Um, I was thinking it was more or less protecting the foot like almost like a blister and filling with water in there. Come to find out, that's exactly what was happening. When they thought it was an abscess, it was actually fluid buildup from the broken bones. So the wound kept getting bigger and bigger and bigger. They kept cutting, 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 and now it is, as you saw the picture, how wonderful it looks. I can literally, at this point in time, when I go to clean the wound, it's the opening area, I can literally touch the bone with my finger. That's how bad it is right now. So, and I can feel it. So that's hopefully answering a lot of your questions. The foot was reconstructed in 2010. They fused all the bones together. I was doing great. Still had pain, but it was doable. And now everything, I have hardware and they're holding things together. Everything's just letting go, and there's really nothing for them to reconstruct or fuse. If they do, it'll take 6 months for me to see if the procedure takes. And then if it don't, then I'm back in having the leg cut off after all with possible infections, etc. So I've got, they are still treating me for diabetes. It is what it is. I will keep track of my numbers to make sure that everything's okay, so it will heal faster. In this case, this foot ain't healing at all. And with that, I've also have cellulitis of the legs because of everything that's going through my body, all the infections. That's why I have good days where I can talk and bad days where I can't think straight. So I hope that answers your question, or questions, I should say. As far as the first time I noticed that there was a problem with my foot, because that was asked just the other day, when was the first time you noticed that you had bone problems? I I never, as a kid, I never thought I had a problem. Um, I mean, I knew I was born with a defect, but I didn't find myself having a problem per se. I guess the first time that I found that I had a problem um, was through people, kids, adults. It's amazing in society. It's we could be living a very happy life, but it's everyone around you that the people we don't know that tends to put a damper on that. I always knew I had a defect. I knew that I had a foot that was a bad foot. Um, I was raised, and some of you that grew up with me knows my mother was is pretty hard woman as far as uh, she pushes you, and she knew that I had the problem with my foot, and she didn't want anything stopping me. She wanted me to do whatever I could with it, and so she raised me to be very um, uh, driven. So um, I remember the first time um, I actually found out that I had a problem was um, in grade school, I guess, if you want to go that far back, because I had to wear these ugly Forrest Gump orthopedic shoes. Before that, it was the Forrest Gump braces, right? Um, and when I was really little, and because I have pictures of my father holding me up over his shoulders with the brace going in between. um, then I went to these orthopedic shoes when I was a kid. My neighbors' kids that I grew up with that were wonderful never had a problem. We always played games and everything like that when I was little. It was in grade school. I was going to. I lived in a small country town in Northeast Ohio, and there was two schools at the time. One was up sort of like a private, but it wasn't a private. It was East North Avenue School, and the other was at Captain Taggart. It was when I moved to Captain Taggart they had most of the problems because I didn't know any of the kids. And when I moved in there, and they saw the shoe, it just gave them something to tease, and I guess they call it bullying now. Um, it is what it is. Um, it was middle school. I remember, and I'll never forget, the coach of the football team coming up, and we were all standing in line, and my mother happened to be in line at the time, and with me, and I don't know what we were in line for, all of us kids, but I remember the coach had come up and put his hand on my shoulder and said, "Young man, you'd be good on our football team. You should join." Blah blah blah, and start talking to my mom about joining football. And I remember my mother saying that he can't join football because of his foot. And she started explaining to him, and I started listening, thinking, "But I want to join football." Um, but hearing that come from her, that and I remember the coach saying, "Okay, well, if you ever want to, just let me know." And he walks away. And I remember the boys that were around me um, were giggling. And I had said to mom, I want to join, I want to do. And she goes, "You can't. If you hurt that foot, you're done." Because they had said that I could be in a wheelchair by the time I got to high school. So she was trying to get me through all this. Um, it was after that that I started really being teased a lot because of my foot problem. So that was the first time I heard from anybody that actually had a problem, because to me, I was just a happy kid. And then it went on from there up and through high school years, where people just was wanting to be cruel because I was different, I guess. Um, and it actually, I look back and I can throw names out faster than anything, and different things that happened. I mean, I can remember because of this. I and I'm sorry if I embarrass anybody on here, um, but I have a best friend through high school that's on here, and I also have a very dear friend on here, and both of them will know that I I I could go on a date or anything, and people were still wanting to pick fights or whatever, and they really didn't know why. I could throw different situations out. I could throw things out where I'd go to the pep rallies, and I hated pep rallies because the coach at the time in high school would line all the players up, and each one of them got to have a punch of my shoulder. And this all stems back from being a kid and being different. Um, but it made me actually stronger through life and tougher. But aside from that, hopefully that'll help some kids out there that claims to be bullied or whatever you want to call it nowadays. I just called it as self-esteem builder because that's exactly what it did. It just made me more confident in life. But that was the first time I actually knew I had a problem. I even joined karate because of different circumstances. Loved it. Um, I used that foot like there's nothing wrong with it. And you're probably thinking, well, football, karate. In high school, I just wanted to be able to do it. I just wanted the experience to do it. So it was my 8th grade year, I think I started karate. And mom finally gave in because I was pushing the subject so much. So, and I was constantly at her, and she figured, if he's not going to have much time on the foot, might as well let him do what he, wants with this. So, I did, and everything was fine. And it was just until I started getting older that things started progressing. I was in Canton, Ohio, working for the government then, for the mayor's office, and I was out in the public a lot. And 2009, 2008, 2009, when my foot started giving me severe pain, where I had to use a cane to walk with, and the mayor, the Democrat mayor at the time, which is kind of ironic, um, had stated that he didn't want the public to see me walking that way, or limping. It wasn't good for his reputation or publicity purposes. And when he had said that, I took it very hard and said, then fine. We're just going to have a surgery done then, and I'm going to be out of work for a while. So in 2010, that's when I had the reconstruction done so I could be seen in public again. And then it didn't take, and whatever. So that's where we are now. So everything's coming quickly. I still have tons of things to do, but it doesn't look like I'm going to get to everything. So Monday morning, 8 o'clock is when I report at the hospital. Tomorrow I'm going to take it like a free day and just relax, or try to. Does anyone have any other questions for me before I end this? I'll wait for a few minutes. I hope that answers everyone's questions. As far as now goes, yeah, I can still, I feel pain, but I feel it in different ways than you would. I break out in this huge sweat. I mean, my clothes will be just drenched with water, with sweat. And then I know I'm really having a lot of pain. I get very weak and tired. I have to lay down and sleep. Today was the most I've ever done, and I think it's just because I pushed through it, and by moving everything on my own. And you probably would have laughed because I was using the power wheel. If it wasn't a huge piece of furniture, then I was using the power wheelchair with a dolly and trying to drive up and down, maneuver down the hallways with it to get everything packed up in the car so I could move it. But I actually am looking forward to. Thanks, Faye. I'm actually looking forward to Monday, to get away from the pain, to see what the future's, what's out there. I just found out the other day I can still go whitewater rafting after this. So I was kind of stoked about that because I like to go rafting. It's just a scary situation because I'm afraid when I first wake up, and I'm a little bit conscious. I think that's going to be the first time it hits me is when I look down and I'm scared as to what they did take off. Because I've known of cases when they've got in there and they had to go higher. And then I worry that the prosthetic, when they start fitting me, something will be wrong, right? I don't have a leg. Um, our goal is to have a leg and walk soon. I'm going to push it. So I've already got a physical trainer ready, so that when I'm able to start lifting weights and stuff, he can get me in there and getting back to normal. And you're going to go on that journey with me too. But I guess that's all I have to say. If there's any other, let me see if there's any other questions here. No, Denise, I'm not on steroids right now. Nope, not at all. No. Thanks, Carol, by the way. No, I'm not on any steroids. The spikes I'm having and the sugar levels is what they had said was due to the pain, and the infections that I'm getting will actually cause them to go higher. So when they admitted me in the hospital the first time, my sugar level was, I believe it was, what was it, 420 something. It was close to 400 when they actually admitted me, and my blood pressure was pretty high too. It was close to 285, I think it was 260. And they said now that was all due to the infection and the pain. So even though there's no infection of the bone, even though they've got the sepsis, I still have infections when the bone pushes down on all that tissue, and the tissue swells. It holds the moisture. The moisture gets all those little microorganisms in there and starts creating all that bacteria, and it takes just one in there to start creating havoc. And then I'm on antibiotics, but you can still feel that I've got infection in me, but because I still feel sick. So, Linda, thanks. I appreciate that. Hi, Lori. I wish you would have been here earlier. I was kind of tearing apart a diagnosis. It's good to see you. Through my sugars as well. And I think, Denise, you go through a lot of pain as well, do you not? It's difficult, but I'm Dr. Crow. I'm just basically saying that I don't believe that, and you'll probably disagree with me, and I don't want you to have a medical forum on here. That's not my purpose. But I feel that diabetes isn't always, I think it's pre-symptomatic sometimes to other diagnoses. I don't feel that it's just, because always the food we eat or our inactivity. I feel that there may be other illnesses that may cause a secondary diagnosis of diabetes, if that makes sense. If I'm making sense with that, please correct me if I'm wrong, but just because of what I'm going through. So that's just now, Denise, to answer your question too about the diabetes, due to my sugar levels, they're saying that's why it's not healing as well as it should be, of course. So I want to thank all of you. I know some of you just joined, but you can go back and listen. I know I got off the tangents there, but again, these talks, actually, with our world today and everything that's going on in the world today, I feel that there's kids out there that's just lost, and I think you all know that. There's friends of mine on here that's lost loved ones, lost their children to suicide. It's a cruel world, worse than it was when we were growing up. A lot of us were growing up, I should say. So I'm hoping that, out of this, not only does it have to do with illness, not only does it have to do with lifestyle or experiences in life. That's why I like to hear everyone else's point of view so I can bring them out. And eventually I'll do that more after the surgery. But it's It's to help others out there. Maybe they're going through a situation where, the kids are bullying them because of their condition. Not always are we, not always are things as clear as they seem. So I have patients that in my past that, I've seen people mistreat, the staffing sometimes, they're tired and they're very short with the patients. Things are timed now where it didn't used to be. Um, the patients are lacking human touch that they used to have. And we don't always put ourselves in their shoes. We'd much rather judge them first and uh, know about them or not know about them at all later. And we shouldn't do that. And there's so many lost kids out there today that just don't know where they fit. And there's lost adults for that matter that don't know where they fit. So hopefully these tapings and that I'm going to keep them going even after the procedure and try to discover a way to do all this to help others out there. I mean, I've lived quite a while and have some experiences. Now it's time for me to share them with others, and hopefully it'll help. So I love you all. Let me see if I have anything else before I go here. Uh, Lori, yeah, I'll preach it, man. Um, hey, Frankie. Yes, Lori, you understand then, right? It's funny because when I was a patient in the hospital last time, I don't care what capacity you work with a patient, but the discipline back when you guys are going to laugh, and I think Denise and Brad will know this, but years ago, I was 14 years old. Was it 14? Yeah, 14. I started working at Salem Hospital, volunteering as a male candy striper. And if, in the event that some of you don't know what that is because you're too young, there used to be candy stripers that used to wear a red and white. Denise, I think you were a candy striper. Love you too, buddy. Um, yeah, I think Denise, you were a candy striper, if I'm not mistaken. We used to wear. Um, oh God, no, you weren't. I don't think you were a candy striper. I think that was just the dress you used to wear. I'm sorry. Um, There used to be a pink and white striped clothing that you used to have to wear, and you would be responsible to assist the patients at bedside, like giving them their mail or their ice water or what have you. Back then, you had nurses, female nurses, and then you had male orderlies. And I just so happened was put with two male orderlies at Salem Hospital, and they took me under their wing at 14 years old. And back then, you could get away with a lot of things. And that's where I learned the first time I learned how to give a blood pressure. I saw a Foley catheter being put in and taken out. Looked painful as heck. Um, they taught me a lot. Every time there was something new, they taught me, and they were allowed to. You wouldn't be able to get away with it now. And there are no candy stripers, from what I understand, anymore. Um, but that was my first experience in medicine. I loved it, and that's what I wanted to go into all my life. So the discipline back then was so totally different. And so when I was in the hospital this last time, after 28 years of working next to bedside with patients and keeping those same disciplines and not changing, I'd much rather if I was a nurse dressed in all white than I would in different colors and patients not knowing who the hell you are. That's just me. And a clean uniform and a good personality goes a long way. When they'd come in to dress the wound, they would not know what it was to do it sterile, and it used to bother. I mean, it bothered the heck out of me because I'd be observing them and telling them, no, you don't do that. No, you can't use that. You got to throw that away because you touched it. All these different things, and they looked at me like, who's this guy telling me? And towards the end of the time, we made friends, but I was probably their worst patient in a way because I'd laugh, but in between the laughter, I was teaching them. And they didn't like it. I mean, the patients I have coming into my office, I would have individuals that, are very sick. And it's amazing when you just touch them with your hand. I don't care. I mean, you just put your hand on their shoulder, or you give them reassurance, or but just that touch just goes so much further than a pill. And you see their face light up. You see different, things about them where they come back the next week and they're feeling much better. Their spirits are up. I think we're killing our human nature and the ability to heal faster through the drugs. And that's not always the answer. So, if that makes any sense to anybody. Um, I'm dating myself. What the? I think you were in the class. That's what I thought then, Denise. Okay, I thought you were. Um, so, anyhow, and Linda, you were in a candy cane outfit. All right. So I think I answered everyone's questions. Does anyone have any more? Linda, I gotta have a picture of you in a candy cane outfit. Um, anyhow, I'm gonna let you guys go. Again, I'm gonna tell you once again, and every day I'm probably on here, that I love you all, and I thank you for being with me through this. It means a great deal. I've never in my life um, thought I would have such an outpouring of support from people that I haven't even seen in 30 some years. And I just said to somebody today, or text them, and said that, it's not the friends that you have and speak to every day that's usually the most important that you hold to your heart. Well, everyone's important, but that you hold close to your heart. It's the ones you haven't heard of from years that are still there for you after all these years have passed. And that's the friends that are true, and that's the ones I hold close to my heart, and see them through thick and thin if I can. So thank you very much for letting me know you guys are out there. Um, but other than that, I will. I don't know if I'm going to um, do this again tomorrow, just because I just want to chill tomorrow and get ready for Monday morning. But I will try to do a live taping, a very short one, um, during pre-op. So you'll see me with my nice little cap and everything on, and maybe you'll see me with some drugs in me, and acting funny, more than usual. Um, and then as soon as I'm able to be out of the sedation a little bit, then I'll come back afterwards, just to let everyone know that I made it. And I think I'll go live during that so that we can be the first ones to see. Um, we can take the covers off together, well, of the leg together, and see that it's gone. And then we'll go from there, and then the transformation begins. All right. So everyone have a blessed evening, a good night, get some sleep, as I will too. And until next time, thank you. Bye for now.